There's another scenario where we open positions for junior doctors called clinical associates, and those are usually specific times when there's a need for such positions, and then SMC allows the registration of these positions, but they don't come on a regular basis, and they generally are not renewable.
Hi there, Dr. Rajiv Iyer here from IMG Secrets, and here we have Dr. Yunam. Dr. Yunam holds a very high position in one of the prestigious hospitals in Singapore.
Hey, hi Raj, happy to be here.
I'm so thankful that you took your time, especially on a Sunday night, to sit with me to talk about this.
Okay, no worries. Yeah, happy to do this.
When I visited you in Singapore, fantastic country, such a great health system. I was really impressed with that.
Thank you. I mean, we really enjoyed having you visit us that time, and I'm glad we kept in touch.
Singapore happens to be a very popular destination. So my question is, if there is a medical graduate who has done his or her medical school or medical college from their home country, could be anywhere, how could they transition to become a doctor in Singapore?
Okay, so I guess they will be classified as foreign medical graduates or international medical graduates. So for an international medical graduate to work in Singapore, we think in terms of the kind of registration that the person can obtain from the Singapore Medical Council, the SMC. So under the SMC registration, there are basically just two types of registration, right? There's a conditional registration and there's full registration. So in order to work as a doctor in Singapore, you have to be conditionally registrable, okay? So in the SMC website, there are information with regards to who can be conditionally registrable. So usually the first thing is that the medical graduate has to graduate from a primary degree that is from a list of universities and degrees that the Singapore Medical Council recognize. So it's called the second schedule of the Medical Registration Act. So there's a list. So if the person graduated from that school, then this is one of the requirements for conditional registration for them to come to work in Singapore. So that's the first hurdle.
Okay. And if someone is not from those registered medical schools, then how do they navigate the system then?
All right, so we were saying that whether or not they can be conditionally registerable is dependent on the basic medical degree. Right. So if you do not have a basic medical degree from a university that's recognized with the SMC, the other pathway is if you have a postgraduate medical degree, for example, the US boards, right, for a specialty like anesthesia, then they could apply for conditional registration, even though the primary degree is not recognized. So these are the two pathways. There is a third one called temporary registration, and that is for candidate that does not have either the primary or the secondary medical degree that's recognized by SMC, but they can still come to work in Singapore for a short duration, usually when they enroll in a recognized training program like a fellowship, for example, in Singapore. So they can come for 1 to 2 years, finish their training, and then they will go back. Usually this registration is not renewable. Yeah, so these are the main pathways that I would say apply across various disciplines and specialties.
Okay, that's great. Thank you. So that's good to know. How does one plan to enter the system?
Okay, they will have to first apply to the SMC for registration, but they also need to apply to get a job. So they will need to apply to one of the registered hospitals in Singapore or clusters or Ministry of Health to get a job and employment from them. And if there's a position, then they will employ them. Then they will then go through the process to see whether their certification is recognized and can be processed through the SMC, right? So you need to have a job and then you need to be recognized and certified by SMC in order to come in for the job. Yes.
Yeah.
Let's talk about food.
What is my favorite topic?
When we went for a dinner, we really had a good time. I was impressed by, even though by size, of course, Singapore is a small country, the amount of variety of food was really amazing. I really enjoyed eating my favorite Indian food. It was very authentic.
I think Singapore, the food scene has really blossomed, especially in the last 5 or so years. 5 to 10 years. And also we have food from the whole range, the whole cost range. We have street food. Here we call them hawker center food. So food that so in stalls in hawker centers, and those are usually quite low cost but very yummy, and they are actually there's a national passion that people will go to various very famous hawker stalls and lined up for up to an hour or so just to get a bowl of something. So that's the food culture. And then on the other end, you have very high-end restaurants, different food types. So it's very exciting if you're a foodie, to be in Singapore.
Yeah. And you get food from all parts of the world, isn't it?
Yeah, so you have Chinese food, you have Indian food, Malay food, you have European, Italian, everything. I would feel that from a cross-cultural point of view, it's really very rich, and the only other place I can think of is maybe like London. You know, have a big range of culturally distinct palates and food.
Well, big cities of US has a lot of options too.
Okay, yes.
And even Canada, Toronto, for example, is fantastic. So they have food from all around the world, and it's really amazing. So yeah, that's great. Anyway, getting back to real stuff about our IMGs. How does, let's say, an IMG can become a resident after finishing their medical school or medical college from their home country in Singapore?
Okay, so I think it also stems from our previous conversation about registration, right? Because they could look at the I could send you the link for the MOHH website.
Okay.
They have a certain pathway where they could enter residency. Usually, the requirements is that they would need to be conditionally registrable. They need to get a job in MOHH as a junior doctor. And from there are certain requirements that allows them to apply for residency.
Oh, I see. Okay.
So I think residency in Singapore is offered by the three main clusters: National Health Group, National University Health System, NUHS, and SingHealth. So there are three separate clusters of hospitals that offers residency programs, and so they could actually even write to the residency program director of each program and ask for more information.
So basically, if I get it right, if a person has completed their, let's say, medical college internship, they look for a job in Singapore, and using that experience, they then apply for a residency in Singapore. Is that right?
Yes.
Okay, got it. And let's say if someone has already done residency in their home country. So if a candidate comes from the countries like UK, US, Australia, I think it's pretty straightforward. But how about if someone is not coming from those countries and that person has already completed residency in their home country and now wants to function as a doctor in Singapore?
So it all comes down to SMC, whether they can be registrable.
Okay.
To come in as a specialist, they must have recognized postgraduate degree. And then there's also certain conditions of how long, how much experience they require, and so forth, right? In order for them to be registrable as a specialist in Singapore. If they can't, or if they don't have a degree that's recognized, a postgrad degree, for example, then they cannot come and work as a specialist. They could work as a junior doctor, a non-specialist, under the supervision of a fully registered specialist in Singapore. But they cannot come in and work as a specialist.
Okay.
Unless they come in and they enroll in the residency program.
Sure. Yeah.
And go through that, which is very much similar in the US too, right?
Yeah. In the US, what's happening is there have been a lot of shortages right across many specialties like anesthesia, radiology, and many others have a lot of shortages. So we've been actually bringing in quite a few folks directly as fellows if they've completed their residency from their home countries, and sometimes directly as attending physicians, even though they have zero experience in the US. So it's kind of similar, but with subtle differences. Are there any shortage of doctors right now in Singapore, or are you guys doing okay?
Well, I can't comment on the shortages, and I'm sure there are shortages of doctors. I just can't give you a very exact number as to which level we're talking about, whether it's junior doctors or whether it's specialists in which discipline. But well, in Singapore, it is very difficult because if we cannot go through the SMC, right, then there's really nothing one can do. So it has to work through the registration process, and very few exceptions are made, except in the cases of a very needed specialty or expertise from a very specific person. In those situations, the exceptions could be made, but generally it's quite difficult.
Yeah. So interestingly, I was talking to one of my colleagues, and he was telling me one of his friend who is from India actually directly became a attending physician in nephrology in one of the prestigious hospitals in Singapore. I thought that was a really good pathway. I think that aligns with, I think every specialty is different, and depending on how much shortage or not they are having. And of course, you always need a candidate who is qualified to obtain that. Not that anybody who walks the door can get it. I think that might be the biggest barrier.
Yeah.
All right. So that's fantastic to know. So I think the biggest thing one needs is having a registration through Singapore Medical Council, right?
Yes, I think that's the primary determinant.
Are there any options for, let's say, doing fellowships Say, for example, someone is already a specialist in their home country. Can they transition to be a specialist? Or as a fellow, I should say. Can they transition to be a fellow?
Okay, so we are talking about people who are specialists in their countries, but they do not hold a degree that is recognizable, whether it's primary or the postgraduate degree, right? So these are the group of people we are talking about. So they can come in to train in a fellowship, and for them, it will be what we call temporary registration. So they can come in for the duration of the fellowship, which is either 1 or 2 years. So different departments and specialties will offer different fellowships. So they can come in for that. But they can't stay after that.
Okay.
Yeah, there's another scenario where we open positions for junior doctors called clinical associates. And those are usually specific times when there's a need for such positions. And then SMC allows the registration of these positions. But they don't come on a regular basis. And they generally are not renewable. Yeah, when the IMG comes in to take up these positions. So they leave when the contractual period runs out, unless they enroll in some further training programs in Singapore that allows them to be considered for either extension of that registration or to become conditionally registrable if they enroll in a training program like a residency program or equivalent programs in Singapore.
Okay, that's great. So the next question is, let's say if someone has done a fellowship in Singapore as an IMG, can they use that experience to transition to become an attending?
Nothing to do with the fellowship, but again, they can be registrable as a specialist. So if they want to be attending, they have to be a specialist, and then they have to be registrable as a specialist. And there are very clear criteria for that. They have to be conditionally registrable.
Okay.
At the least, yeah. Okay. And that again would depend on whether their primary or the secondary degree is recognized and whether they have the appropriate training. So for attending, they would need to have a postgraduate that is recognizable. Yeah.
Okay.
If it's not, then there is no pathway, as far as I know, to specialist registration in Singapore.
Okay. And to obtain these type of positions, are there any language requirements required? Do they have to pass any language exams?
Okay, so in Singapore, English is the primary language.
Okay.
That they need to be proficient in, and they demonstrate their proficiency by passing the IELTS, which is an English exam for which they need to have attain a certain band of performance for that. So they need to pass that in order to, as part of the overall registration process with SMC. They don't really need to know any other language, although it is better if they can, right? But English is a must, yeah, and proficiency in that is needed.
Okay, cool. That's all I can think of. I cannot think anything else. Again, you're heavily involved in hiring a lot of international medical graduates because of your very high-level position you have in Singapore. Now, is there any tips or any takeaway message that you have for IMGs that can make them more successful?
I think one of the challenges that I have seen in people coming to work in Singapore from another country is they may come from a country with a different culture, a different way of working. So there's no right and wrong, but I think people who are adaptable and with a keenness to learn and adapt is generally do better. And I think Singaporeans generally work quite hard. I don't know how that compares with, maybe the US residency or the UK, but there has been a move towards making the working hours more humane, more rational. But by and large, people do work quite hard, and the work cultures tends to be a little bit always on, which we are trying to move away from. Yeah. So sometimes that may cause some difficulties. So I would say the biggest thing is probably the cultural shifts that they need to navigate when they come to work in Singapore. But if they are adaptable and keen to change, and I generally think they do quite well.
Yeah, I think that's a good point. See, I haven't worked in Singapore, but I know a lot of people who are native of Singapore, because I know quite a few people, as you know, right from my days of doing my fellowship in Canada, which has been more than 15 years ago. So I can say that the people in US and Canada work significantly less as compared to those in Singapore.
Oh, really? Okay.
So in fact,
I think it's just different way. Yeah, different culture, different work environment. Yeah.
Yeah. So, in fact, I was thinking of working in Singapore many years ago. The common friend you and me have, I don't want to take his name in this video because I haven't talked to him. So, he said, this is how you're seeing the work happening in Canada, but when you compare to Singapore, you're going to work like extremely hard. And so he said, really think about if you really want to move to Singapore and work hard. I really loved Singapore when I visited. It was just a really nice trip for me. I'm looking forward to doing it once again, actually, if time permits.
Yeah, I'm looking forward to that too, actually. Raj, are you involved with the workshop in Boston?
All right, so that's all the questions I can think of, Yunam. And I'm so thankful to you for taking your time and educating me and our IMGs. If you need to talk to me one-on-one, you know how to get to it. You can go to our website and book an appointment with me on imgsecrets.com. Any questions, do post in the comments below. Take care, stay safe, talk to you soon.
Thank you.